Like any nerve of the peripheral nervous system, spinal nerves are made up of parallel bundles of axons wrapped in several layers of connective tissue. In this learning objective, we will look at the anatomy of a spinal nerve, as well as the path that a spinal nerve takes following its exit from the vertebral column out the intervertebral foramina. So the 31 pairs of spinal nerves are named and numbered according to the region and the level of the vertebral column from which they emerge. However, not all spinal cord segments are aligned with the corresponding vertebra, given that the spinal cord ends at roughly the second lumbar vertebra. So the roots of the lower lumbar, the sacral, and the coccygeal nerves actually descend from the bottom of the spinal cord at an angle to reach the corresponding vertebra and intervertebral foramina before they then emerge from that vertebral column. So once the spinal nerve, or cranial nerve for that matter, exits the spinal cord or brainstem, it's made up of many individual axons surrounded by layers of connective tissue. Individual axons within a nerve, whether they are myelinated or unmyelinated, are wrapped in a endoneurium, the innermost layer of the connective tissue. The endoneurium consists of a mesh of collagen fibres, fibroblasts, and macrophages. Groups of axons and their surrounding endoneurium are then held together in bundles called fascicles. Each fascicle is then wrapped in a perineurium, which is our middle layer of connective tissue. So the perineum is a bit of a thicker layer of connective tissue, which consists of up to 15 layers of fibroblasts within a network of collagen fibres. The outermost layer of connective tissue surrounding the entire nerve is then called a epineurium. It consists of fibroblasts and thick collagen fibres. So from innermost to outermost, almost deep to superficial, we have the endoneurium, which surrounds each individual axon. We have the perineurium, which surrounds our fascicles, and our epineurium, which surrounds the entire nerve. So just to help with you remembering these terms, endo means within. So it's inside of that spinal nerve wrapped around the single axon. Peri means around. So the perineurium wraps around the fascicle. And then our epineurium, so epi means on top of, so it's sitting on top of the entire nerve. A short distance after that spinal nerve has then passed through the intervertebral foramen or foramina, a spinal nerve will divide into several branches, and these branches are known as rami, or ramus as a singular. The posterior or dorsal ramus serves the deep muscles of the skin and the posterior surface of the trunk. The anterior or the ventral ramus serves the muscles and structures of the upper and lower limbs, and the skin on the lateral and anterior surfaces of the trunk. And then in addition to the posterior and anterior rami, spinal nerves also give off a meningeal branch. And this meningeal branch actually re-enters the vertebral cavity through that intervertebral foramen and supplies the vertebra, the vertebral ligaments, and the blood vessels of the spinal cord and the meninges. So if we take a look at this image here, we have obviously our spinal cord in the middle. We have our spinal cord exiting here, and we have our anterior and our posterior roots here. So the convergence where they join becomes our spinal cord, and then it branches off into those different branches. So we have our posterior branch here, which goes off to serve the deep muscles, the muscles closer to the middle of the body, and also the posterior or the back surface of our trunk. We have this anterior branch here, which serves our upper and our lower limbs, and then also the skin on the side and the front of our trunk. And then we have this tiny little meningeal branch here, which goes out and then back in through that intervertebral foramen and serves all of the structures within this space here. So the spinal cord, the meninges, the ligaments, the vessels. Now, if we continue to move further away from the spinal cord, then the axons of the anterior rami of our spinal nerves don't actually go directly to the structures that they supply or that they innervate. Instead, they form a network on both the left and the right sides of the body by joining with several other axons from anterior rami of adjacent nerves. This interconnected network is what we call a plexus, with the principal plexuses of the body, our cervical plexus, brachial plexus, lumbar plexus, and sacral plexus. And we also have a smaller coccygeal plexus. Now, this is true of all of the spinal nerves except for the thoracic nerves 2 to 12. We also call these nerves the intercostal nerves. And given the proximity or the close location of these nerves to the structures that they actually innervate, these ones do actually go directly to those structures. So again, if we take a look at this image here, this is an image of our brachial plexus, and we have spinal nerves C5, C6, C7, C8, and T1. So these are the anterior rami of those spinal nerves. In a plexus, we will also call these the roots. The roots of several spinal nerves then unite to form trunks. So in the brachial plexus, we have a superior trunk, a middle trunk, and an inferior trunk. So it's just some of these roots coming together to form a trunk. These trunks then diverge, or they split into divisions. So we either have the anterior or the posterior divisions, and you can see those represented by the slightly different colour green here. These divisions then unite again to form a cord called the lateral, the posterior, or the medial cord. And these cords are named for their relationship to the axillary artery. So the axillary artery is a blood vessel that runs kind of in your underarm region. These cords are named based on how close they are to this particular blood vessel. From there, the cords then split or reunite again to form the nerves which supply the muscles of the shoulders and the upper limbs. From here, the nerves are named generally for the structures, the muscles, or the regions that they innervate. So for example, we have the axillary nerve, the radial nerve, and the ulnar nerve. So axillary is the underarm region, radius and ulnar are bones in our lower arms. Now, I do not expect you to remember all of this. We do not actually learn about individual nerves or nerve plexuses in regional anatomy and physiology. However, many of you will go on to study further anatomy where you will be required to know the trunks, the cords, the branches of all of these different plexuses. So I just wanted to, introduce you to that concept now. What I do expect you to know or understand for this unit is that nerve plexuses enhance the efficiency and the flexibility of the nerve system by allowing nerve fibres from different spinal nerves to mix and redistribute. So this arrangement helps ensure that even if one nerve is damaged, that the functions it serves can still be maintained to some extent due to that kind of overlapping of the pathways. So this organisation of nerve plexuses is crucial for coordinating movements, maintaining sensory perception, and regulating various physiological processes throughout the body. It kind of serves a little bit like the circle of Willis in the brain. Now, lastly, the skin over the entire body is supplied by somatic sensory neurons that carry nerve impulses from the skin to the spinal cord and the brain. Each spinal nerve contains sensory neurons that serve a particular region of the body. The area of skin that provides sensory input to the central nervous system via one pair of cranial nerves is called a dermatome. So D-E-R-M-A-T-O-M-E. Now, the nerve supply in adjacent dermatomes or dermatomes that are next to each other will overlap somewhat. However, knowing which spinal cord segment supplies each dermatome makes it possible to locate the damaged regions of the spinal cord. If the skin in a particular region is stimulated but sensation is not perceived, then the nerve supplying that dermatome is likely damaged. Similarly, given that the plexus or network of nerves that a single nerve can pass through to reach a dermatome, when undertaking, let's say, a surgery or a particular part of the body needs to be anaesthetised, for complete anaesthesia to occur, several adjacent spinal nerves may need to be blocked by an anaesthetic drug. So lastly, a written summary of all of those structures for you. So the endoneurium is the connective tissue surrounding an individual neuron axon. The perineurium is a connective tissue surrounding the fascicles, which just is a bundle of axons within a nerve. The epineurium is a connective tissue that sits on top, surrounding the entire nerve. A plexus is a network of nerves arising from the anterior ramus or branch. Within the body, our major plexuses are our cervical, brachial, lumbar, and sacral plexuses. And lastly, a dermatome is an area of skin which is